Hello, 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 everyone. How are you? All right, so I just need my team to tell me if my mic sounds nice. Hello, hello, hello. I see someone saying good morning. Hi, Vina. Thank you, Ms. Mills. Ms. Mills said, hey, I sound good. How is everyone? Thank you so much for coming. We didn't give everyone a lot of time to get here. We just kind of said, let's do this. And we did. All right. So, welcome to something you all have been asking for. That's why we're doing it. We are going to talk about CPT and HCPCS Level 2 modifiers. Now, this isn't a course, so it's less formal, and we're going to get into it. And yeah, it is going to be highly engaging. All right, so I'm going to shout you all out in a moment, but I do want to shout out my team. I just want to say hello. Thank you so much, Mr. Sandeep, Ms. Mills. And you know what? I'm not quite sure who's all here, but I did see Miss Beth. I did see Miss Haley. Hi, Miss Haley. I saw Star Wars Girl. That's our intern. I saw Vina. If I missed anyone, please let me know. Mr. Sandeep, I don't know who that person is, but it says AMCI medical coding, so let me know. I see you, Ms. Vina. Okay, so I'll be shouting you all out all the way through, and let's get into what are the goals of this class. Well, the goals, we only have three. Number one, we're going to learn common CPT modifiers. Number two, we're going to learn about HCPCS level 2 modifiers, the common ones. And three, we're going to bring you one step closer to mastery. In fact, not only is our goal to enable you to master, by the end of this class, you will have mastered three modifiers, and they're very important. So let's get going. So before we get started, I want to know what you know. Yes, we got a poll. All right. So in the chat, put your answer. How comfortable are you with coding CPT and HCPCS level 2 modifiers? A, I'm confident. B, I'm okay. C, so so. D, I need help. Or E, what are modifiers? Go ahead, put your answers in the chat. All right. So we're little this gives me a lot of information. Hi Linda, how are you? Okay, okay, okay. All right. So good, good, good. So we don't really have anyone that's like, I'm confident. All right. So this is where you belong. And I needed that. Okay. So I want to begin this discussion by kind of giving you a little bit of context, right? Because we keep telling you what a modifier is. A modifier modifies a code, right? What does that mean? Well, let just listen to my little, it's not a story, but listen to my little context, okay? All right, so let's say you've been dreaming about a vacation, a European vacation for years, right? So you go ahead, you save up your money, you work extra hours, you do overtime, you don't you bring your lunch, you're saving, and your ideal vacation is you want to do a European vacation. You want to go Paris, you want to go to Italy, and you want to go to Greece, all three, right? So you're going to do it. This is your bucket list. You're going to do it. You're going to get your passport. You're going to get your airline tickets. You got your itinerary. You're ready to go. So When you take this trip and you plan this trip, there are going to be some things that you'll need to um, do to accommodate the trip. All right. So you're going to pack your clothes, right? You're going to arrive to the airport. So you're all ready to go, right? And so you're telling everybody, I'm going on this European trip. And that's what you expect to do, right? Yeah, you're going to go on this trip. But just saying you're going on the trip doesn't mean that was your experience, right? Because just like things in life, things happen, right? So you could experience maybe your flight to Paris. Let's say you're leaving from Dulles to Paris. Let's say it gets canceled, right? And let's say midway, let's say you're in some other country and you just kind of stuck, right? Let's say that your husband surprises you and say, "Hey, I'm going to join you." Let's say they lose your luggage, right? Let's say that something gets taken from your luggage. Let's say that when you get to Italy, you get sick. And then you got to make a detour. You got to cut your trip a little short. In fact, you might just want to go home. So you did have some modifying circumstances to that European trip. Okay, coders, are you following me? That even though the trip may have taken many detours, whether they're good or bad, and there are some good detours, they had multiple modifying circumstances or modifying factors. Key word, modifier, right? So the trip, they still went on the trip, but they had those detours along the way. And just like that trip of a lifetime where these modifying factors changed the trip, it didn't change the fact that they went, but it changed, there were some factors that kind of changed it. Surgery is the same way. There are incidents and circumstances that could modify surgery, but the surgery still happens and sometimes not. So, over the next 4 weeks, we're going to learn how to tell that whole story about surgeries by using modifiers. And we're going to begin week 1 with mastery of modifiers 22, 52, and 53. Now, before we go any further, do you all know that a a list of modifiers are in the front inside cover of your CPT manual? Are you all aware? And if you aren't, I want everyone to pull out your CPT manual and open up the front inside cover. When I open mine, there's a page stuck to mine. So I'm going to pull it apart and I can see my modifiers at a glance. So I want you all to get familiar with that. And also, these are just abbreviated definitions. Now, the full definitions are in the back in Appendix A. So if you just aren't sure and you're not clear and you need that full definition, you go to the back to Appendix A and go grab that modifier definition. All right. Now, I still want to know what you know. Just by you saying, "Hey, I feel good," I really want to know. So I have a true false exercise for you. Now, someone's talking about HCPCS level 2. We're not talking about that yet. But yes, Thank you. Very, very good, Mia. All right. So we got some questions. I want to know what you know. Modifier 22 is reported when a procedure requires substantially greater physician work than is normally required. True or false? What say you? And feel free to answer. Don't wait until I finish reading it. If you want to answer it quickly, go right ahead because we are a couple of seconds delayed and don't let me slow you down. Good that, a couple of people said, hey, I'm going to put that answer in. Now, I'm not going to tell you if it's correct or not, but I will commend you for taking just go ahead, put your answer. We will not judge you here. No judgment zone. And the answer is true. Number two, I'm going to pick up the pace, everyone. So if you can read it before me, that'll be great. Modifier 25 may be reported when a significant, separately identifiable E&M service is performed on the same day as a procedure. True or false? What say you? And I know that some of these definitions don't really explain what it is, but I'm giving you this definition because that's the definition that they provide you with. But yes, believe me, I will explain them more in depth. And if you said true, outstanding. Next question. Modifier 26 identifies the professional's part of a service. True or false? What say you? Go ahead, put your answers in the chat, and you all are rocking it. All right, I see Couture Dream Divas. I see you, Karen T. I see you, Mia. I might not be saying your name right. And I know these are screen names, so please forgive me. B. Frazier, I see you. Welcome, welcome, welcome. Sue Cabela, welcome back. Welcome back. All right, Mima. Okay, musically. You all are just doing an amazing job. Okay, Deborah, Ann, outstanding. The answer is true. Next question. Modifier 32 is used when a procedure is mandated by a third party, such as a court or insurance carrier. Mabe, I know I'm not saying your name correctly, but I'm going to say it. Outstanding. Thank you. Look at my interns. You all are rocking. I see you, Vina, Miss Haley, there's Star Wars girl. I see you all. Hey, B. Frazier. Okay, Linda, I see you. And I see you too, Lindsay. Good job. Orlika, very good. I know I'm probably not saying it correct. So, Sherry, outstanding. Go. You all said true. Way to go. Next, modifier 47 is reported by the anesthesiologist to indicate anesthesia performed by the physician. True or false? Okay, Kimmy, I see you. Thank you. They are. They are rockin' Vina. Walaka, your name is familiar. True or false? Yeah, you are like, I don't know about this one. True or false? True or false? Put your answers in the chat. Hi, Melissa. Sapphire. Yes, this is recorded and I will show you how to get it at the end. But while we're waiting, if you go to the YouTube channel and you click on our lives, all of our recordings from all of the lives can be found there. Good job. The answer is false. The key word is anesthesiologist. Modifier 47 is reported by the physician or the surgeon, never the anesthesiologist. Way to go, way to go. And if you learn something, outstanding. Okay, modifier 50 is used when a procedure is performed on both sides of the body during the same operative session. True or false? All right, Lily, you're waiting to become an intern. You just come on over and talk to Ms. Mills. She's right in the chat. Okay, look at all these great answers. Way to go, Sherry. Way to go, Mabe. Way to go, way to go, way to go, Mima, Mello. All these M's. The answer is true. That's right. You know what? You will have this one down next. Modifier 51 should always be appended on all multiple procedures performed during the same encounter. True or false? That's right. They're on fire. On fire. Okay. All right. So Lily May, contact us again, Ms. Mills. Lily May said she filled out an application and she wants to be an intern. We'd love to have you. Okay. Couture, I see you. Okay, Sherry. Lindsay. All right. I'm loving the fact that you answer. I'm not telling you the answer, but I love the fact. And you know what? Look at that. Okay. Something came up on my screen. All right. And the answer is false. And I'm going to tell you here is something common knowledge. Whenever you're taking like multiple choice exams, when you see this word all, every, never, just weigh it very, very carefully. When in doubt, rule against it. But if you know for a fact, then you go with what you know. All right. So very little is all, never, always. I'm not saying all the time, but I'm just saying very little. So modifier 51 should always be appended on all multiple procedures. That's false because when you think about it, bilateral procedures, that's multiple procedures, right? So you're not going to append a 51 on a bilateral procedure. All right. Good job, everyone. Hopefully that was an aha moment. Okay, modifier 52 is used when a physician intentionally reduces or partially performs a service. True or false? What say you? And if you don't know, take a guess. That's it. We're here to learn, and we're going to learn about modifier 52 today. All right, we got those answers coming through, and the answer is true. Yes. Okay, modifier 53 is reported when a procedure is started but discontinued due to unforeseen circumstances or concern for patient safety. True or false? What say you? That's right, they are getting it. You are doing amazing. That's right, Miss Beth. Beth, I'm loving this participation. Come on, coders. What say you? Okay, I'm going to pick up the pace, and I know your answers are in there. I'm just a little lagged. And the answer is true. Modifier 53 is used for discontinued procedures. All right, modifier 58 is used when a patient returns unexpectedly to the operating room for a related procedure during the post-operative period. And if you want to peek in the book, go ahead. Your book is going to be with you when you take your exam. Yeah, so feel free. And if you don't want to, you want to do it by memory, feel free to do that as well. All right, so the answer is a few more seconds, and that answer is false. Yeah. So it's not I believe the other modifier that you would use would be 78, not 58. All right. Let's keep going. Modifier 59 may be used to identify a different procedure when procedures would typically be bundled. True or false? What say you? Okay. Welcome, new member. I like your name, hepatologist. Hey, they may be. Let us know if you are. All right. So the answer is true. Absolutely. Keyword is different, but we're going to learn to distinguish them, I believe, next week. Modifier 62 indicates that two surgeons worked together and each performed a distinct portion of the same procedure. True or false? What say you? All right, I see those answers coming through, and you all are moving so fast. And I know you're putting those answers in, and the answer is true. This modifier requires that two surgeons perform this are working on one procedure. So two surgeons aren't carrying out two different tasks, they're carrying out the same. So if they're operating on the heart, both of those surgeons are doing the work on the heart, not one doing a harvest of a graft for the heart. No, those are two different procedures. So they have to be working on the same procedure. All right, modifier 66. This indicates a surgical team was required to complete a highly complex procedure. True or false? What say you? Okay, good answers coming through. All right, the answer is true. Way to go, way to go. All right, we're getting down to the wire. Modifier 77 is reported when the same physician repeats a procedure. True or false? That's right, they're spot on. All right, I'm going to put the answer up. I know you all are answering, and the answer is false. It is not the same physician repeating a procedure. Modifier 77, if you open up your book, is repeat procedure by another physician or other qualified healthcare professional. Now we're moving on to modifier 80. This identifies an assistant surgeon. True or false? Okay, I'm going to say the answer is true. Modifier 90 is used when laboratory services are performed by an outside reference lab. True or false? Look at that. You are so fast. So fast. They're reading faster than me. Good. The answer is true. Now, here's another question. Modifiers 59 and modifier 51 can be appended to an add-on code. True or false? What say you? All right, the answer is false. You may never do that. We know you can't add modifier 51 to an add-on code, but more recently, modifier 59 has been, added to that guideline as well. So modifier 59 and 51 cannot be added or appended to an add-on code. And if I move too fast, I don't know if this will help or not, but there were only 5 incorrect or 5 falses. And I'm just going to put this up on the screen for a moment for you. Hopefully you can see it. If you can't, I apologize. And if you can't, you can watch the playback and enlarge it. But if you watch the playback, you can see the others as well. But I want to take a moment to look in the chat and just really encourage you all. Somebody said, aha, that's right, Lucky. That's right. All right, let's go. Now, one thing I want to tell you, um, let's talk. Let's just have just a regular conversation. So we know that these are modifiers, and we know that modifiers modify a procedure. And you know what a modifier really does? Number one, it's going to either increase the payment. Number two, it's going to decrease the payment. Or three, it's informational only. It's going to explain the story. It's either one, two, or three. And these modifiers you can use as many modifiers that apply. And these modifiers also have sequencing order. So in other words, if the modifier impacts the money, that's called the functional modifier. And it should be sequenced or used or appended before the informational modifier. So your functional takes precedence over the informational. Good. Somebody said they can't believe they remember so much. That's good. Someone said modifiers are their friends. I love it, JBV. Okay, Lily, I see you. All right, so now let's go ahead and let's get into our discussion. And we're going to hone in on modifiers 22, 52, and 53. And we're going to call this the CPT modifiers of volume, more, less, or stop, right? So modifier 22, if more work was needed or it was more extensive. Modifier 52, if less or reduced work took place. And modifier 53, that procedure was stopped. You all with me? I need somebody to answer in the chat. And if you're not, you can say, hey, Mrs. J, you're going too fast. Okay, I see a few people answering. Good, good, good. All right, so let's take a procedure. The procedure that we're going to look at is an exploratory laparotomy, right? Code 49000. This is our base procedure code. Now, if an exploratory laparotomy took place and that was it, you would just code 49000. However, if you had a modifying circumstance that increased this procedure or made it more difficult, you're going to need to append a modifier 22. So let's say the patient was morbidly obese and had lots of maybe had a previous abdominal procedure and had lots of adhesions. If the documentation says that, then you will append modifier 22 for increased procedural services. Now, let's say that the doctor was supposed to carry out this exploratory laparotomy. And when you're doing these laparotomies, these exploratory laparotomies, you're looking at a bunch of anatomy, right? So you might look at the stomach, the duodenum, the small intestine, the colon, the liver, etc. But let's say the doctor said he went in, he looked at the stomach, and that was it. And he said, you know what? I don't need to go further. I see everything that I need to see right here. So that doctor should not be entitled to that full laparotomy procedure. And in the documentation, he will specify that, hey, I did less. I viewed less of that anatomy, and he's going to append modifier 52. Are you all with me? And modifier 52, type in the chat what the definition of modifier 52 is. I mean, just the brief. Somebody said that I'm going a little too fast, so I'm just going to slow it up just a bit. You know what? I'm not seeing the chat. Okay, good. Now it's coming through. All right. So yes, it's reduced services. So modifier 22 and modifier 52, they're the exact opposite of one another. And you should be able to identify them by the number 2 in the ones column. All right. So 22 and 52 are the opposite of one another. Now this modifier 53, this is if they had to discontinue this laparotomy altogether. They had to stop it before the surgery took place, right? And sometimes during, but often it's before, like at the induction of anesthesia, etc. And I'm going to explain why. All right. But the thing that you should always remember that the money is almost always impacted when you use these 3 modifiers. When you use modifier 22, that provider is going to get more money. You use modifier 52, that provider is going to get less money. Modifier 53, probably nothing. Probably. And sometimes they will. Let me correct myself. If they put 53 on there, they're going to get some, but not as much, right? We have to pay for the doctor's time. Now, I want to go back to my analogy of that European trip, right? So when that trip was more difficult, that person to had a delay and their flight was canceled. That was more difficult for them when they had to go to the hospital, to the doctors, and perhaps cancel their trip and go back home. That's more money. Yes, difficulty is often attached to more money. And that would have been modifier 22 if we put modifiers on trips. But yes, this is a modifying circumstance. Now, if something happened where they did less, for instance, the person who got sick canceled, their the part of a portion of their trip. They didn't go to Greece. They were sick. If they stayed in wherever they were in Europe, they didn't pay for maybe expenses, sightseeing, etc. They may have still had to have paid for it, but they paid less because they didn't go. Now, if they went home, they might have paid more. And if they just didn't go altogether, let's say they missed their flight, then that would have been a modifier 53. And they still may have had to pay for the trip, but not as much. So hopefully you understand how modifiers work. And just like in medicine and medical coding, the money is almost always impacted. Now let's turn our attention back to 22. Remember, I said this is a mastery. We want you to master. I want you to leave here and I want you confident in knowing what modifier 22 is. This is increased procedural services. Modifier 22 is used when that provider performs a substantially greater work than is normally required. It is the exact same procedure, but significantly more difficult, complex, or time consuming, right? So 22 means that provider had to work extra hard. And how do you know the provider worked extra hard? Well, those keywords are going to tell you. You're going to see keywords in your documentation saying extensive, severe, significantly increased. This procedure was complicated. It was difficult. It was a difficult dissection. We had prolonged operative time, greater than usual effort, So it's not going to be something light. These adjectives are going to be very it's going you're going to feel it. You're going to say, "Hey, this was tough," when you read that documentation. All right? So, what you need to do, ask yourself, why, what, how much, and why again? Why was this procedure more difficult? What was the additional work? How much time or effort actually occurred? Or why did this specific service exceed the expected norm? So you could ask yourself that, but you don't really have to. Just look for those keywords. The keywords will tell the story. And you can never assume. Never assume. Just look at the documentation. All right, so these are some of the things that might catch you. So you might see language like, this took slightly longer. Slightly longer? No, we said extensive, right? We had some minor complications. Nope, that's not going to cut it. An unexpected complexity. No, be more specific, doctor. Normal obesity. No, that's not going to cut it. Now, when someone's morbidly obese, that might make you say, hey, this probably is. And then you might want to look more for more documentation to substantiate using this modifier 22. All right. So so how do you all feel about modifier 22? We're going to practice in a moment, and I want to move on to modifier 52. So let me know how you feel about modifier 22. You understand that it is extensive. It increases that procedure. It modifies it in a way that it increases that procedure. Okay, good. So people said they're pretty good. Now we're going to turn our attention to modifier 52. And modifier 52 is the opposite of 22. This is reduced services. So it's a procedure or service partially reduced or intentionally less than normally performed. The defining characteristic is choice. The provider intended to do less from the outset or made an elective decision to reduce the procedure. All right. And modifier 52 has some keywords: limited, partial, reduced, incomplete examination, less than usual, electively discontinued. These are some keywords that'll, in the documentation that will point you to, hey, this modifier 52 is, this is the modifier you should use. All right. So now, when you're looking at your documentation, in order to apply this modifier 52, the documentation must document the reason why the service was reduced, the scope, what specific portion of the procedure was actually completed, and the choice, why the doctor made that decision to reduce the procedure. All right, so I think reduce, they're a little more relaxed on reduce. And now we're going to turn our attention to discontinued. The procedure was started with every intention of completion, but was discontinued because continuing would place the patient at severe risk, or the intention to finish or safety forced a hard stop. No matter what, this was stopped. Now, I got to tell you, all stops are not discontinued. It rests on the documentation. And I'm going to explain how you can determine the difference between discontinued and reduced procedure. Somebody said the harder you work, the more it costs. Right. The less you work, the less. All right. So now we're on stopped, discontinued. These are your key words: discontinued, aborted, terminated, procedure stopped, safety concern, patient instability, arrhythmia, respiratory distress. These are all common keywords. These are not all. This is not an exhaustive list, but this should point you in the right direction. Now, your documentation can, when it's pertinent to the safety of the patient, why they halted the procedure, why exactly was that procedure stopped, the threat to the patient, what specific documented safety concern occurred, the progress, how much progress was successfully completed before the halt. This is key right here. That progress will tell you whether you can code a um, modifier 52 reduced or stopped. Okay? And the justification. Why was it unsafe to continue? Now, here's a warning when not to use modifier 53. If it was never started, if the procedure never started, then you can't stop it, right? Right? So you don't need modifier 53 if it never started. And also pre-anesthesia, if it's canceled during the pre-anesthesia, like at the induction of anesthesia, you don't use modifier 53, you just don't bill it. And elective, do not use for intentional non-emergency reductions. They tell you to use modifier 52. In other words, you know what? Okay, let me just stop and pause right here. If the doctor says, okay, I'm going to stop right here. Let's say the doctor enters the patient's body and says, looks in, does some you know, observation, or might just kind of just look around. That doctor is entitled to be compensated for that. And this is not necessarily a discontinue. This is more like a modifier 52. Now, modifier 52 is different than modifier 53 because you will need to determine what took place. If the doctor did anything, then it's typically a modifier 52. If the doctor really didn't do anything, just observed, eyeball, gross, then it's a modifier 53. And that's typically. Yes, someone said, will this be on playback? Absolutely. And I'm going to show you where you can get it. Okay, so this is the slide that explains the difference is down to the intent versus the circumstance. It's reduced if the doctor did something, it's stopped 53 if the doctor really didn't. So it's based on the documentation. What did the physician do? You focus on that and you can't go wrong. Are you all with me? All right. Somebody said something in the chat. Awesome. All right. So the base operative procedure tells us what happened. That laparotomy tells you what happened. The modifiers tell us how it happened. Either it was more extensive, it was less than expected, or we stopped it. 22, 52, 53. Now it's your turn, coders. Are you all ready? Okay. All right, so I have a scenario here, and we're just going to kind of go with the flow. If you can read it ahead of time before me, that would be fantastic. If you want to wait for me, that's good too. All right. Which modifier should be appended to the procedure? Modifier 22, 52, 53, or 59? A 58-year-old patient presents for excision of a benign lesion on the scalp. During the procedure, the physician discovers extensive scarred tissue from a prior traumatic injury that significantly complicates the excision and closure. The procedure required extensive dissection and nearly doubled the expected operative time. So you all might be saying, okay, Mrs. J, since you read it that way, right. So I'm just going to go ahead and pull out those modifier focused keywords: extensive scar tissue, complicates, extensive dissection, double operative time, and you all got it. Outstanding. It is 22, increased procedural services. Outstanding job. Outstanding. Great job. A physician. Oh, no, no. I gotta. And for those of you, this is your first time with us, welcome. But we do read the answer first. All right. Which last sentence first and the answers. Which modifier should be reported? 22, no modifier, 52, or 53? A physician performs a colonoscopy that takes longer than usual because the patient had poor bowel preparation requiring additional irrigation and repositioning. The physician successfully completes the procedure. Which modifier should be reported? A, B, C, or D? All right, I'm going to let a few more answers come through. And if you said be good, because there was only language like longer than usual, right? Nothing extensive, or you know what I mean? You got to have that language, and no modifier is the correct answer. That's right. We do have great participation. All right. Which modifier should be reported? A, 22, 52, 53, or technical component. A patient is scheduled for a bilateral diagnostic mammogram. Due to severe patient discomfort, the provider completes imaging of only one breast and elects not to continue the study. What's the answer? Is it A, B, C, or D? Okay. What are my modifier focused keywords? This patient had a bilateral mammogram and only one breast was completed. And the doctor said, hey, we're not going to continue because the patient is in is in pain. All right. So, which modifier reduce the procedure? Because remember, we have to compensate the physician for what they did. We don't focus on that it was stopped. We focus on what they did, and he did or she did. They completed one breast, right? So, 52 modifier reduced procedural services. And I'm going to let that marinate. Remember, focus on what that physician did. Good job, good job, good job. All right. Which modifier should be reported? A, 53, 52, 59, or 22. A physician schedules a colonoscopy. However, because of an obstructing stricture, only a limited examination of the colon is completed. The physician elects not to proceed beyond the reachable area and documents a partial examination. What say you? Okay. So here are my modifier focused keywords. Only a limited exam, partial exam. You know what? The doctor did something, right? So if the doctor did something, it's modifier 52. You all are getting this. Getting this. I'm going to let that marinate. That's right. Way to go. And if you learned something priceless, there's Mr. Sandeep shouting you out from the screen. Thanks, Mr. Sandeep. All right. During a sorry. Which modifier should be appended? A, 53, 52, 22, or 59. During a cardiac catheterization, the patient develops ventricular tachycardia shortly after catheter insertion. The physician immediately terminates the procedure and stabilizes the patient. What say you? Okay. Yeah, this one's a little tough, huh? So the doctor immediately terminates the procedure, but I also too want to focus on the fact that a cath was um, introduced into the patient. So no procedure, nothing was done. Like there was no assessment. The doctor didn't go in and assess. He just advanced the catheter. So I'm not saying he didn't do anything, but it's not going to count. And that answer is going to be 53. It's discontinued services. All right. So if the documentation says that the doctor did something, saw something, etc., then that counts. Whereas just entering the surgical site may not. Okay? The doctor's got to tell us we got to follow the documentation. Hopefully that makes sense. Now, we're almost finished. Which modifier should be reported? A, 22, B, 53, C, 52, or D, 59? During an upper GI endoscopy, the patient becomes increasingly anxious and requests that the provider stop the examination. The physician only viewed the esophagus and stomach and did not view the duodenum. The physician discontinues the procedure before completing the intended study. What is the answer? Now pay attention to what the doctor did. Did the doctor do anything? That's going to distinguish 53 from 52. What did the doctor document that they've done? Okay, here are my modifier focused keywords. Well, during the upper GI, patient becomes anxious. The provider stops the examination, but the doctor viewed the esophagus and the stomach. So the doctor did something. So this is not a stop. This is a reduced procedure. Somebody said they're getting it. I love it. Good job. Good job. Good job. Remember, coders, always pay attention to what the doctor did. What did the doctor document that they did? And that will pretty much, that's going to drive you to the correct answer. All right. Which modifier should be reported by the physician? A, 53, B, 52, C, 73, D, no modifier. A patient's brought to the OR for arthroscopic knee surgery. Prior to anesthesia administration, elevated blood pressure causes the surgeon to cancel the procedure. Okay, coders, what is the answer? Type your answers in the chat. Okay, so, well, prior to the induction of anesthesia, the surgery was canceled. What did the doctor do? Well, the doctor did absolutely nothing. So it's no modifier. They didn't even have surgery. They didn't, enter the surgical site or anything. It was canceled before surgery. Yeah. Boom, home run. And it's more of a home run if you learned something. And for those of you who got it correct, outstanding, outstanding, outstanding. And it just takes a moment, just slow down a little bit and process, marinate. Definitely watch the playback. Watch it, right? All right. So basically, modifier 22, more. It's turned up. Substantial work. Modifier 52 turned down. Intentional choice to kind of turn it down. The doctor says, hey, I'm going to skip this or I'm going to, do less. And modifier 53, that means it stopped in the process or somewhere in the process, but the doctor really didn't do much or anything. All right. Remember, you can't stop what never started. So if it didn't start, no modifiers at all. And I just want to just tell you, remind you that modifiers 22 and 52 are the opposite of one another. Now you're all ready to rock and roll. I think some of you have moved towards mastery. You're on your way, and we've got 3 more weeks to go, and we are finished with the modifiers 22, 52, and 53. And next week, we'll keep testing it just to make sure that you kind of get it. Also, don't forget about your the inside cover of your CPT. That's where your modifiers are. If you want our reference cheat sheet, I will give it to you. And I'll probably have it for you next week. If you're an MCDC student, it will be in your course. So you don't have to worry about it. And speaking of you MCDC students, leucine is your, it's in your course now. What is leucine really quickly? It is your AI coach, but it's powered by AMCI instructors. We're there every day answering your questions and making sure that you have the support that you need with your scenarios. So if you want to test out the modifiers, you've got some modifier questions. So check it out. It's in your course. And also check your email. We sent you an email and also a demonstration on how it works. All right. So again, our agenda is, for the first weeks, sorry about that. For the first week one, we tested or we moved towards mastery of 22, 52, and 53. Next week, our focus is going to be 50, 51, 59. And yes, we'll be testing all of the modifiers from week to week. All right. And for those of you that want to know where the playback, how do I get to the playback? Go to our YouTube channel, AMCI YouTube channel, and then click on the live. And then you just go to the live session that you want the playback of. It will be sitting here. So right now it is live now, but immediately this will become your playback. All right. And that's it. Oh, while you're at it, don't forget to like it up. Right now, can you like up this video? We only have 0 likes right now. Well, at the time of me making this, we had none. So if you can do me that, I would appreciate it. And we've got a survey team. The survey is in the section, the notes section. Please, if you will, put it in the chat. And I just want to thank my team, Mr. Sandeep, Ms. Mills, Ms. Haley, Miss Beth, Miss Star Wars Girl, Miss Vina D, Miss I feel like I'm missing somebody. I feel like I'm missing somebody. And I do apologize. I do. All right. And some of you are here so often, I'm almost mistakenly call you interns. So I just want to thank all of you for coming. And Rue, I see you. Welcome. DC Kicks. Hey, how are you? And, thank you all so much. Miss V Taves, good to see you. Lucky always. Walaka, Prakash, and that's it. Look, can you believe we are on time? And fill out that survey. Let me know how we did today. Did you learn something? Did you learn? Is there something more? I only wanted to focus on those 3. Next week, I promise you, it's going to be amazing. All right. So I just want to say so long, everyone, and we'll see you next time.
4,000 exam passers and free classes at AMCI. Learn to coach straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around.